We value the beginning of life, and we need to value the end of life. Each one of us will come into this world and leave it. Both of those are privileged times to cherish. And so hospice is a way of embracing a patient and their family as they journey to the end of life.
I think that you don't realize how important the hospice house is, or the NVNA services are, or the care support is, until you or a loved one are in that situation.
Having Mom here, we knew she was getting personal and loving care, and she had her own room, and it was quiet, and it was human, and it was dignified.
The nurses were so caring and just respectful of privacy, yet seemed to know somehow when you needed them. And it was just so reassuring. It was so relaxing in the most stressful time of your life.
The age-old mission of the Norwell Visiting Nurse Association since 1920 was neighbors helping neighbors. And that is what the Norwell Visiting Nurse Association is all about. It is about community. NVNA and Hospice is a visiting nurse association and hospice services that also has palliative care, cancer support, the hospice residents, and a private duty company. And the reason for those companies is to provide continuity of care.
Our palliative care program is tied to our VNA nursing and rehab services. So what we do is we frequently take these patients on a little bit earlier in their trajectory of their illness, so they don't necessarily have to be at the end of their lives, and we're talking to them and building that relationship. So as things change with their disease, we're able to continue to change the services we provide and meet their needs.
The philosophy of the house is that it is a person or a family's home while they're here. That's the concept that we want to give back.
This house is so much of a home. It doesn't feel medicinal at all. You know, you look out the window and you see a great view.
The gardens are amazing. You can go outside and just sit in the sun and just have time to think.
And it's done in a way that is just with the ultimate of human dignity in mind.
It's a home for them with all the support that is needed at the end of life. Myself, chaplain, if they'd like it, spiritual support, a doctor's wisdom guiding that staff and that nurse, a social worker helping them, because hospice looks at the whole person. It's not just the disease.
Once we came here, we realized what an enormous emotional and physical benefit it was to the family.
Everybody doesn't have the financial means to pay for the room and board for this. Part of our philanthropic mission is to provide care for anybody who needs it. And we don't ever want to be in a position to have to turn anyone away because they don't have the means to support their stay here.
It's so important to give, knowing that you're not just helping the patient, you're helping their significant other, you're helping their children, you're helping their friends. And really, you don't realize it until you're in that situation, but you're helping so many people.
My first involvement with the Norwell VNA was for palliative care for my husband. He was diagnosed with cancer January 2014.
Joe was a guy who really loved in his family and his friends. He was a quiet presence.
He was not only a brilliant doctor, but such a kind and humble man.
We would have celebrated our 25th wedding anniversary this month. When we knew that his cancer was terminal and that Joe would not have long to live, we discussed a lot of things. And so I made that promise to him that he was going to stay home and he wasn't going to go into a hospital and he was going to be surrounded by people that he loved.
The staff at NVNA came in and they took over, and they took over with care, they took over with compassion.
He was able to die at home, and people came for 3 days and sat with him and talked to him and said their goodbyes. I've said this many times, he had a good death. You can have a good death.
When I saw the type of care that Joe was able to receive, and then came and saw this beautiful facility, the Pat Roche Hospice House, a light bulb went off, and I thought, you know, we have to do something to make sure that this place is here for everybody.
We didn't use the house because we didn't need to, but we were lucky. And so I wanted to make sure that this house can stay here and that there is funding for it.
The truth is, philanthropy will be the margin of difference in the success story of this home.
I think it's very important for people to donate to the NVNA and the hospice house and the NVNA services. I know that they just helped myself, my mom who was in their services, and my whole family.
We have that gift. We have that thanks to the VNA and all those who've supported us in this. It's a sanctuary that affords people a peaceful passage with all the care and blessing that they need.